Lack of treatment of breast cancer in Black women due to racial discrimination in healthcare.
My name is Rosa Arena Zuniga, and I'm introducing our topic, which is the lack of treatment of breast cancer in Black women due to racial discrimination in healthcare. The recent incidents involving the murders of both Black men and women continue to spread awareness of the racial discrimination faced amongst the Black community. This recent outcry for social advocacy has brought forth many of the underlying prejudice and racial bias in the health community. Black women suffering with breast cancer have endured various incidents such as being misdiagnosed, not receiving adequate treatment, and also being mistreated amongst health professionals. This New York Times article, posted in 2014, underlines the racial divide of women in relation to breast cancer, where Black women have a 40% chance higher of dying from breast cancer than white women. This concern of a racial divide amongst Black and white women arises questions in relation to the healthcare system. Is this system arranged in a way to allocate for white women, who have a much more lower mortality rate than Black women due to better testing, better equipment, and better treatment options, while Black women suffer a much more higher mortality rate due to insufficient testing, insufficient equipment, and lack of treatment options? This divide between Black and white women suffering from breast cancer has continued to widen throughout the past decades. Roughly 20 years ago, the mortality rate of breast cancer amongst Black and white women was relatively the same. But during the 1990s, the death rate amongst white women depleted rapidly, while the death rate of Black women has continued at the same pace. With the increased incidence of Black women receiving less than adequate testing and treatment options, Dr. Whiteman, a director of the Sinai Health Institute, starts to question the American healthcare system, as it seems to cater to the needs of white women who suffer from breast cancer, who have benefited from the advances of breast cancer research in the past 20 years. Yet the same health system seems to discriminate against Black women, who suffer the highest mortality rate between any race in America. It is undeniably structural racism, quotes Dr. Whiteman. He mentions the lack of quality testing and lower access to screening provided for Black women with breast cancer as contributors to this high mortality rate. With the increased awareness of racial inequalities through the Black Lives Matter protest, many have started to question the integrity and diversity of the healthcare system. Is the health community as diverse and as inclusive as we claim it to be? If there is a significant racial divide noted throughout the health community, why is there such a lack of awareness and advocacy amongst the healthcare professions in America, despite this large difference?
Hey, my name is David, and I'm going to be analyzing and explaining the two main peer-reviewed sources that will be brought up throughout this presentation. The first article addressed African American women and analyzed both genetic and social aspects that are related to higher diagnosis of breast cancer. The study shows how Black women have a 40% higher breast cancer death rate compared to white women. They are more oftentimes diagnosed at later stages of cancer and do not receive the appropriate care that corresponds to that exact stage. On the genetic level, Black women are more likely to have dangerous and more treatment-resistant subtypes of breast cancer than white women. The article also outlines how stress is a potential contributor to breast cancer, explaining how DNA methylation and the response of receptors represent past psychological stress or a form of trauma. There have been findings of methylated DNA in breast cancer tumors, suggesting possible links to psychological stress and the cause of breast cancer. Since minoritized neighborhoods are known for poverty and have led to various psychological traumas, the article outlines how it is important to be able to recognize this issue and be able to give special attention to people who are minoritized. A study was done in 2015 following a Black woman in the process of her breast cancer diagnosis. An uninsured Black woman had entered the emergency department of a hospital in Chicago with the concern of a breast lump. The medical professional thought it was an infection, and without further testing, the woman was prescribed antibiotics and was sent home. After the antibiotics, the lump remained and required the woman to receive a mammogram, where it revealed that she had breast cancer. The author really emphasizes how it is extremely important to implement equal and high standard breast cancer care to everyone. It is important to recognize that race is a social construct and not a biological category, and that the racial inequality found in the healthcare system is not an outcome of genes, but a result of unequal distribution of resources and treatment to the community.
Hello, my name is Kylie, and I'm going to analyze the philosophical approach and theory associated with healthcare discrimination.
Racial bias in healthcare is the reason why 40% more Black women will die due to breast cancer than their white counterparts. It is unbelievable that we live in a day and age where a person will be racially profiled and discriminated against in a healthcare setting. In the journal article, Understanding and Effectively Addressing Breast Cancer and African American Women, Unpacking the Social Context, authors take a critical social theory approach to the issue and prevalence of racial bias in the healthcare setting. Furthermore, the authors uncover the power imbalance and constraints on Black women and their right to proper healthcare and treatment. With lack of care, social norms and discourses are prevalent in society in how we perceive certain people and scenarios. In many instances, healthcare professionals believe Black people have thicker skin and can handle more pain than white counterparts. Race does not determine pain tolerance, and this concept leaves us to question the very people we trust our health with. Socioeconomic stress and breast cancer rates were also observed by uncovering how income, education, and occupation can correlate to having breast cancer in later years. In America, in 2013, Black households earned 59 cents for every $1 earned by white households. This meant that it was difficult to go to examinations, or once diagnosed, they could not afford treatments. Thus, healthcare bias often comes down to economics and its interrelation with medical treatment. This article describes the different statistics, scenarios, and outcomes for Black women pre- and post-diagnosis with breast cancer. This opens a discussion regarding the treatment of Black people with healthcare as they are being marginalized and enhances our knowledge to understand racial bias and discrimination. Black women should not be dying due to their skin color, because when looking at this issue, these women do not die of breast cancer, but rather racial discrimination. For prevention in a critical social theory perspective, according to these authors, healthcare interventions, education, investigating social contexts, and prevention in terms of science are needed. There are so many ways to go about racial bias in healthcare, but they only ever matter if the healthcare professionals they are intended to educate will listen.
Hi guys, my name is Jalal, and today I'll be talking about the cultural considerations of the lack of treatment of breast cancer in Black women due to discrimination in healthcare. Time and time again, new methods of discrimination against Black women in the U.S. are presented to us, and with the number of accounts and incidences that are presented, it's almost as if these new findings are of no surprise. Regarding the healthcare system, Black women in America do not have adequate access to healthcare, and this is largely due to discrimination. The lack of treatment experienced by Black women in the U.S. is mainly due to structural racism, a term referring to the discrimination of a specific race through societal institutions and systems. The impact of structural racism on Black women in the U.S. can be seen by the impoverished socioeconomic status of nearly a fifth of all Black individuals across the nation. More specifically, hospitals in Black communities are poorly funded, poorly maintained, and have a scarcity of cancer-specific professionals. This is endangering Black female lives as it's making their diagnoses unreliable and their prognosis worse against a disease that is defenseless against modern-day medicine. This discrimination is also a testament to the deeply embedded structural racism in a nation which has been shown to oppress its non-white citizens, especially Black women, over centuries and centuries of struggle. In other cultures that make up a large portion of American population, namely Latina Americans and Asian American women, lack of knowledge of symptoms and stigma were found as the highest contributing factors to the high rates of developing breast cancer. Within these communities, other barriers such as language and socioeconomic factors also contributed to the issue, but unfortunately, Black women remain at the center of the discrimination, even amongst other minorities.
Hi, I'm Isabel, and for my topic, I'm going to be discussing about nursing implications.
In the nursing field, it is very important that you as a nurse provide comfort, safety, and care towards your patient. But the question is, how do nurses do it? As a nurse, it is important that you understand, follow, and promote social justice in the nursing field. Social justice is sharing and providing equality of healthcare no matter the patient's religion, skin color, culture, etc. It is essential as a nurse to always provide care in a social justice approach. This means that nurses need to promote public policies that improve the health of marginalized population by addressing social inequities, as well as making sure that everyone is getting equal and no less or no more care than others. As many issues arise in the hospital, one that is still occurring is lack of treatment of breast cancer in Black women due to discrimination in the healthcare. Nurses can examine clinical outcomes and routine measures of health according to patient race, ethnic background, gender to assess healthcare equity in their hospital. In addition, nurses can employ and make a difference in changing the community perspective to disqualify racism in the hospital. One of many ways nurses can do this is being able to educate and talk about different diversity to others in the healthcare system in order for them to respect everyone at the same level. As well as, nurses need to go against stereotypes of Black individuals in order to explain to other healthcare professionals that we do not need to base our care for a patient based on their skin color. With the help of social justice and these nursing implications, we can stop this issue.